Welcome to a session on writing a research proposal. As a nurse student or as a nursing personnel, when you are working in a hospital, you want to do a research because you want to bring in the change in the practice, or you want to give evidence for any decision making or improve the quality of the care or reduce the cost of the care. You have selected a topic or a research problem, done a literature review, but now you are stuck up how to write a research proposal because you have to submit this proposal to your authorities for the approval. So in this session, we will see how you can write a research proposal in a simple way and submit to the authorities for the approval. Let us see what is nursing research and why it is essential. Nursing research is essential because it will increase the body of knowledge, bringing the evidence for patient care, bringing the evidence for decision making in an administrative unit or in the educational institution. And various studies have emphasized just teaching nursing research to nurses is not enough. It is very important that all the nurses should conduct the research and they should be involved practically in making a proposal and conducting a research and disseminating the findings. This is very important. What is nursing research? Nursing research is a systematic inquiry that uses various methods to answer the question or to solve the problem. It is a systematic inquiry to develop some evidence. New knowledge can be created, interventions can be experimented, and programs can be evaluated. So you can do anything what you want to do. And there are qualitative and quantitative methods which you must have studied during your GNM, post-basic and various other courses. What are the steps of research? You plan, that is planning. Once you have planned, then implement, then writing. So, research proposal is a part of planning. Planning means identifying the broad area, extensive literature review, narrow down the research topic, collecting argument, identifying the gap area, writing a research problem, then you write a research proposal. So, writing a research proposal is a part of planning. What is a research proposal now? Research proposal is the detailed plan of the study. Every research study should have a written proposal. You have something in your mind. Unless you write it, what is your problem? What are the objectives? What are the research questions? What is the methodology you will adopt? How you will analyze and interpret the data? This has to come in a written form. All these components are part of research proposal. Research proposal communicate your research problem and proposed method of solving it. Once you have selected a problem, but how you will solve, what will be your method, that detailed methodology, which is most important, will come in your research proposal. Research proposals are written by a researcher and they are submitted for the approvals to the research committee of the institution or for the funding if there is any funding agency, and for the ethical approval for institutional ethical committee. Research proposal is simply a structured formal document that explains what researcher planned to research your topic, why it is worth researching on that topic, that means gap area and justification, and how researcher planned to investigate, that means the detailed methodology. So these are the important components of your research proposal. What is the purpose of your research proposal? As already I have told you, research proposal give a chance to explain the significance of your research study, why it is important to do this study, and how it will bring change in the nursing or in hospital care, cost, quality of care, and suppose any funding agency wants to fund this, what will be the advantage to that funding agency if you are doing something on that particular research area. It demonstrates quality and importance of study, and even the ability of the researcher who is proposing, will the researcher will able to conduct this study. Suppose you want to do some study which has a qualitative and the quantitative, that is mixed method study. So when you present it, the committee may assess your competencies as a researcher. Will you be able to do independently this research, or you need some co-author, co-guide with you? So it depends. Competency of a researcher is also very important. Proposal gives an opportunity to the researcher to review their progress, to see that what are the questions, what are the challenges that may arise. So that methodology will give all these things when you write in detail. It may helpful to review the progress and follow the methodology. If you have not written the methodology in the beginning, then it will be a problem for a researcher how to reach the sample which I have selected. How to select that sample? If that sample, suppose you have selected some particular disease, but that sample is not available in the hospital. If you have to go to the community and select that sample, how you will collect? How many people you will get? So your old studies review will give you all these clues, and then you will decide about your study, how much people I have to involve them, what are the ethical considerations, what will be my timeline, what challenges can be faced by me getting permissions, getting the data, and if the patients do not agree, what will be my strategy of collecting the data. All these things are to be a part of methodology. So writing a research proposal now. Writing requires thought process, critical analysis, time and effort. It is not that just copy paste from somewhere. You have to put in efforts. You have to critically analyze your own proposal depending upon the problem. Understand the audience who will read your study. It is a creative, simple writing, not very sophisticated literature English. It has to be simple English sentences which has to be written very creatively so that reader who is reading your proposal will have interest in reading your proposal. And it is very important, fix a timeline when you will complete each and every step and when you will submit your proposal. So read the literature extensively, read the abstracts, read full studies, make notes and note down the references. If you forget to note down the references, later on you will be searching from where I have taken this quote, from where I have taken this study. Immediately there is reference management system, Mendeley or any other system you can adopt and note down. Even some of the students till now they write in their registers or whatever way is comfortable to you in the beginning, you can adopt the methods to write down the references. So discuss with the department, very important. If you are doing some study for your hospital, ask the questions. Ask questions about that study. Feasibility, critical analysis of your problem, observation in the clinical area, attend seminars and conferences so that you understand about that topic in detail. Select the important problem which has a significance, not just for the sake of doing a study, which will be useful for your profession, for your hospital, for your patients for decision making. That is very important. Then strengthen with argument with extensive review of literature so that you can convince your research committee why this area is to be taken as a research topic. Writing a research proposal requires in-depth knowledge and understanding of research area and problem, clinical issues, the gap areas, what is already done within discipline, clinical implications, benefits and harm if any in case of any intervention. If you are doing any intervention or comparing new intervention with the standard treatment, critically you have to analyze what will be the benefit not only to that my participant but also to the community and the society as a whole, and what are the risks during the study intervention, after the intervention. There are minor risk or major risk. If there are any risk, which has to be clearly mentioned in your proposal, and what you will do to handle those risks. In case patient has any complication, your participants, what will be the methodology or modality that you take care of those patients also. You cannot leave them if in case they have any side effects or anything due to your intervention. Writing a research proposal, that's why they say it is a very tedious process, and once you write your research proposal, your 50 to 60% of work is done, because now you know you have to follow the steps given in your research proposal which is approved. Now what outline or format to be followed? That is a one question it comes to a mind of a new researcher. Always remember your institution will have some format of writing a proposal. If you are getting funding from any agency, then you will follow the guidelines given by the funding agency. Basically, any research proposal will have a topic, introduction of background that will give the current scenario, importance of the topic, benefits of the topic study, need and gap areas, justification with in-depth review of literature and research questions. Then you will have your conceptual framework which you will make yourself as a researcher, and in case you are following any nursing model or nursing theory or any other model or theory, you will give description of that, you are adopting it, adapting, or you are changing it. Then you will write a research problem, objectives, hypothesis if any, or research questions. Then comes in detail the methodology, in which you will include research approach and design, population, sample, sampling technique, your sample size with justification, what tools you will use in the English, Hindi or the local language which will be translated and retranslated again into English, validity and reliability of these tools you will carry out. Then you will do the ethical aspects you will write down, and you will write down pilot study, when and where you will do the pilot study. Then the next aspects will be your data collection procedures, data analysis, and in data collection your various tools and techniques what you will use. Then your data analysis and interpretation plan, informed consent what you will take, the sample has to be there in the English and the local language or in Hindi. Time grid, very important to make for each step when you will complete your making a proposal, ethical clearance, when you will start your making tools, that timeline within 1 month or 2 months, how much time you will take. Then all the references, because you have to avoid the plagiarism when you give the references. Very important to keep this in mind. Depending on the policy of an institution, if you need any supervisor or principal investigator or co-author, depending on the institutional policy, you will be allotted that in case they feel you cannot do this study independently, because that supervisor will be like a mentor, like a supportive guide or expert in that area. They will help you to carry out this study and also have interest in that particular area. So when you review a proposal, keep some questions in mind, or when committee review this proposal, they also have this mind. What are the researchers' plan of study? Why study is needed? What methods are being proposed? Are they appropriate? How and when data will be collected? Will it be feasible for the researcher to collect within that time frame the data and the tools are appropriate? And whether researcher has the skills and the competency, and whether the proposal is ethically sound. This then main in gist what I can say, how they evaluate the importance of the question, adequacy of the methods, ethically sound, time and money. So these are the important aspects. Even as a researcher you have to keep in mind, even the ethical committee and the research committee will keep in mind. When you present, see that your presentation is simple and concise, color scheme is simple, highlight important points. If you have given 10 minutes, 15 minutes, keep your mind that time limit. Plan your presentation in that. Maybe extra things during discussion you can tell them what is in your mind. So your presentation should include the importance of your research problem, present justification with the arguments with extensive review, objectives, methodology and references. You have to be very concise presentation. Approval of the proposal. Now you have written a proposal. You are happy, satisfied, your proposal is written. Now you have to get a approval. Researcher prepare a proposal in a format which he or she submit to a research committee of an institution, and if that research proposal is to be presented in front of that research committee, it is been presented and maybe suggestions are been given. Write down the suggestions rather than arguing. You can give your justification. Still, if they are not satisfied, write down those points and discuss with your co-author, and then you come back and strengthen your proposal. That is very important. Next aspect is your ethical approval. Two important things keep in mind: ICMR guidelines to be followed and IC approval to be taken. National Ethical Guidelines for Biomedical and Health Research involve human participant ICMR 2017 guidelines. Very important to understand, these guidelines are applicable to all the biomedical, social, behavioral science research for health conducted in India involving human participants, if even you are using their biological material and data. 2017 guidelines to be followed by nurses, doctors, allied health, even social scientists if they are doing in a health sector. While conducting the biomedical research, 4 basic principles I think all of you know that has to be kept in mind: autonomy, beneficence, non-beneficence and justice. Very important to keep in mind these 4 important principles of ethics. Risk-benefit analysis. Very important when you write a research proposal, you have to see what are the benefits of this research and what are the risks. Benefits to the individual, community and society means any sort of outcome, favorable outcome, direct or indirect, should be available to everyone, not only those who can pay, who are in a creamy layer, who can afford everything. No, it should be available to everyone. Your vulnerable group, women, elderly, any group vulnerable has to be included in the benefit. Social and scientific research should justify the risk if there is any discomfort, physical, mental, economical, then social risk, anything is there. If you see benefit risk assessment by ICMR, less than minimal, that means if you are already using the data which is available in the public domain or doing a meta-analysis, that means there is a less risk, very less than a minimal risk. So you have to, don't worry about so much. Minimal risk means every day, suppose I am doing something in the kitchen, I have little cut, or I little bit with the heat I burn my finger. That is your daily routine, what you do. If the risk is of that level, then it comes under minimal risk. So this ethical committee will also see, research committee, and even as a researcher, you have to analyze. Minor increase over minimal risk if it is more than your what is in a daily risk what you face. Suppose you are doing something regarding randomized trial, you are doing on children, you are doing some study on adolescents, on some psychiatric patients, and something intervention or social risk is there or economic risk is there, so that will come under minor increase over minimal. But if you are doing some clinical trial or intervention, then it comes under more than minimal risk or high risk. So approval, you will approve, do not initiate any study without ethical approval. Submit to the ethical committee as per your guidelines of your institution, and the ethical committee will invite you to present your study, and they will go through the methodology in detail. And every participant, remember your informed consent. When you take informed consent means you have to give them in detail about your study, what you are going to do, what will be the benefits. They can leave any time of time. You cannot force any patient or any student or any participant sample to continue. And very important is ethically sample has to be selected as per the your selection criteria, which ethical committee will see in detail. So minimize the harm, maximize the benefit. That should be the motto of your study. Then approval, in case the ethical waiver has to be taken, again it will be only given by the as per ICMR guidelines by the ethical committee only. So in this way we have learned about what are the components of your research proposal, what are the processes of writing a research proposal and getting the approval from the research committee of your institution, ethical committee, or if it is of the funding agency. So keep in mind, writing a research proposal is an art and it needs critical thinking, and it is a critical creative work what you are going to do. Thank you.